This is a program that many of you have heard about and called the SMILE program. And Jim mentioned it. It is a program that's being funded by one of the LINs, and VON manages it. And basically, it's a program where frail elderlies are identified, and VON does the assessment and works with community agencies. We do not deliver all the services. This is about collaboration, partnership, making sure that the community organizations get used and work in collaboration. The next 3 slides are not mine. There are slides from the presentation that Neil and I attended last Friday at the conference board, and they were presented by the CEO of the LIN that funds it. So it's not I am bragging and giving you figures. It's the funder who is out there and saying, look what it can do. And I know it's hard to see, but the bottom line is in the table below, there are 2 programs listed. One is SMILE, and the other Home First, which many of you will know as Home at Last. And basically it says that the SMILE program has the ability to reduce 80% of the visits that they call the frequent flyer visitors. Those that go back to emergency room very, very often, 65 plus, and they have nowhere to turn. As I had one of our board members who talked about him not being, having some medical problem, and he said, no, I cannot see my GP for months or whatever. The only thing I can do is to go to the ER. And that's a situation across the country for many individuals. But by using the SMILE program, it is possible to reduce that small group that shows up in emergency room many, many times a year by 80%. The SMILE program can reduce the inpatient days 11% and the Home at Last 89%, and it can save in that area up to 62 inpatient beds. It's just one region in Ontario. And finally, these figures are impressive. The long-term care admissions can be reduced by 46%, and if you combine it with the Home First, by other 54%. The reason I put up this slide and left the 2 programs is that we need to understand that we need synergistic programs. It's not enough to say, oh, I'm going to do one thing. It will get you little return, but if you do more than one, you will get a much more powerful return. Next slide. Here it talks about what can be the SMILE program on emergency room, on inpatient and long-term care. And look at the dollars in the inpatient impact. It can save $2.3 million, and again, it's one region, and it can save over 2,000 bed days. And it can reduce the long-term care admissions. Those are all solutions, and as Jim indicated, it costs around $60 to look after such an individual a week versus 1 ER admission or 1 day in the hospital is equivalent to $1,000. Okay, let's skip this one. Let's skip this one. So our vision and our 6 elements of the vision is well articulated in the vision document, which is on our website, and you should have it in your hand and in your purse when you walk around, wherever you go, whatever you do, so you can whip it out and say, did you know? Okay. So, what's my vision for the future of home and community care and the vision for this country? And when I say my, I mean VON and all of us. Our vision is that we have a publicly funded wraparound system. So that includes the community care. As we talked about this morning, a few of us spent some time with Scott Bryson. The amount of private dollars that we all pay out of pocket for home care is tremendous. Not everybody can afford it. So we have a publicly funded wraparound system. We have a universal health, community, and social system that is person and family centered. Again, you will hear a lot about person and family centered, but most people don't have the first clue what we mean about it. We have a system where the public is confident and that they can expect to be known by the team that works with them, and they can direct their care. So we are in charge of our own care. It's not the care provider that's in charge of our care, that we are engaged and involved, and it's a collaborative effort. We have a system where data and files are integrated across all sectors, and across the country. So we actually can know what medication was given in the hospital, what medication was prescribed by the physician or the nurse practitioner, better yet, or what else can be done, or what are the issues. So when one of our clients go back to the emergency room at night, they can know what the nurse or the homemaker have done that day with that client. We have a system which is smart. Smart homes, smart technology, smart diagnostic and therapeutics. I bet I can talk to each and every one of you, and you will have a caregiver story, and how mom or dad or the neighbor needs to be supported, and they want or they don't want help. But there are technologies, simple technologies, that can make a huge difference. Why don't we have them? And Canada, as I say to politicians around building productivity and industry, can be the leader in that area. We have the right number of providers with the right skills and knowledge. And let me tell you, one of the things I learned when I came to VON is the role of homemakers. They are the unsung heroes that go day in and day out and keep many millions of Canadians at home who otherwise would be in another place. Do we pay enough attention? At VON, we do. Do people pay enough attention to them across the country? I don't think so. Government and employer policies and benefits aligned with the needs of the citizens and employees. I am very excited because in early December, the CEO of Home Depot and I will be hosting a roundtable for corporate CEOs to talk about what corporations can do around family caregivers, how they can support. And that event also supported by the Minister of Health in Ontario, who is hoping to be there, but definitely very much in support of keeping, and it's a national event, it's not an Ontario-centric event. But corporations need to be reminded, and VON is reminding them that they can do a lot of things and support their employees so they become more productive. 10 years is a short period of time. So this is my vision for 2020. 10 years is a short period of time, and we better hurry and get going so we can achieve these goals that are not unrealistic. It is really at our reach, and we're seeing the progress. We need to succeed, and we absolutely must succeed. And we must succeed for the Madeleines and the Phyllises of this world, and for us. Those two ladies are 92 years old, 93. They used to be VON nurses. They retired 28 years ago. And when we send out letters to our alumni, Valerie, who is the daughter of Madeleine, the lady in the wheelchair, said to me, my mother and Phyllis, who is her friend, are still following what's going on with VON day in and day out. And they would love nothing more than to meet the CEO of VON. So in one of my roundabouts, stopped in and visited with Madeleine, and Phyllis came. And Madeleine unfortunately passed away this weekend. And I was fortunate to be able to see them a month or so ago. And Madeleine was in no shape to really have a conversation, but Phyllis, 93 years old, looking after her 60-year-old son, who has been disabled in a work accident. She raised her grandchildren, who told me stories about CCAC and services and so on, and re-emphasizing me how important it is for VON to be successful and being able to do everything that needs to be done. And her parting comment was, I am so relieved. I'm going to be sleeping better tonight to know that VON is in good hands and continuing to do what each and every one of us need. That's why each and every one of us have to do the utmost to make sure that the future is better than it is today. Thank you.